Alrighty, so I have my assignment. I'm going to look over the patient's chart. I can see their vitals have already been taken. I'm going to educate myself on anything that I might need assess or about the client that I don't know about, and then I will go up to the room. I'll check their name, make sure I've got the correct room. I will check to see if there are fall precautions or any other precautions. I see their standard precautions, so I don't need to put on any equipment, and I will knock, 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 knock. Hi there. My name is Carmiel. I'll be your nurse today. Could I ask you to state your name and date of birth, please?
Yeah, Janisa,
Awesome.
11988.
Perfect. As I check your wristwatch. Alrighty. And Janisa, do you know, or can you tell me why you are here?
Just a physical.
Awesome. And then can you tell me where you are right now?
Bellevue College?
Perfect. So I can see your alert, and oriented ×4. So I'm going to go ahead and provide some privacy to you here, Janisa. And what we'll be doing today is we're going to be doing a head-to-toe assessment. All right. So I'm going to go ahead and get my hands nice and clean, and we'll get started.
Okay.
Awesome. So, Janisa, I'm going to get started by asking you a series of questions, and if you could just answer them for me, just to get some information on how you're doing.
Okay.
So first off, are you in any pain currently?
No.
So on a scale of 0 to 10, how much pain would you say you're experiencing? 0. I'm glad to hear that, Janisa. Alrighty. Do you have a family history of heart disease or any lung issues?
No.
Are you currently experiencing shortness of breath?
No.
Difficulty breathing?
Nope.
Any headaches or nausea?
Nope.
Any vomiting going on recently?
No.
Any tingling of the limbs or extremities or anywhere in the body?
No.
Awesome. Have you had blurred vision at all?
No.
Any ringing of the ears?
Nope.
Good. I'm glad to hear all these answers, Janisa. Are you passing bowel? Your BMs, are they as normal as they would typically be?
Yes.
Awesome. Okay. And how would you describe them?
Once a day.
Once
Soft.
a day.
Normal.
Good. No weird discoloration?
Nope.
No blood?
Nope.
All right. What about your urine? How would you describe that?
Yellow. Normal.
And
clear.
is it typical for you to be urinating like you're doing right now?
Yeah.
Oh, I'm glad to hear. Alrighty. Do you have any? Are you currently taking any medications?
No.
All right. Do you smoke?
Yes, I do.
Do you drink?
Yes, I do.
Okay. Do you exercise?
I do.
Perfect. Those are all great things there. Do you ever experience shortness of breath after walking or going up a flight of steps?
Yeah, depending on the amount of flight of steps.
Okay, that's fair. Do you feel as though it's unreasonable for what you'd expect of yourself?
No.
Okay, glad to hear. Do you have asthma?
No.
Do you have an inhaler?
No.
You wouldn't if you didn't have asthma. Do you have allergies?
No, I don't.
Okay. Are you allergic to any medicines?
Not that I know.
All right. I'm gonna go ahead and raise the bells while we're talking, so we're at more of a normal level.
Okay.
Do you? Let's see. Can't do two things. We're gonna
I
raise
know,
the
I
bed
do
and then we'll
this.
talk. All right. Have you had any stomach pain at all?
No.
Awesome. Do you use any assistive devices?
No, I don't.
So no glasses or?
I do. I had contacts.
Oh,
this
perfect.
everywhere.
All right. Do you have those in right now?
I do.
Gotcha. All right. Are you using a hearing aid at all?
No.
And do you use a walker or cane or something
Nope.
like that? Good. Alrighty. Well, those are all great answers. I'm gonna ask you a couple more questions as we go along.
Okay.
But we're gonna go ahead and get started with an assessment of your cranial nerves. All
Okay.
right. So, do you mind if I lift your bed up?
Not at
your
all.
head up. All right. So we'll go ahead and start with that. And so we're gonna go ahead and start off first by assessing your first cranial nerve, number 1, which is your olfactory nerve.
Okay.
And what I'm going to do is I'll have you close your eyes. I'm going to waft something right in front of your nose and just give it a little sniff and let me know if you smell anything and what that smell is.
Okay. Yes, alcohol.
Alcohol. Perfect. Alrighty. So that means that that nerve is intact. Next, we're going to assess your visual nerves, which would be 2, 3, 4, and 6, which are your optic, your ocular motor, your trochlear, and your abducens. All right, so the first thing I'm going to have you do is just take a look over my shoulder.
Okay.
I'm going to be shining a light in your eyes just to check your pupillary reaction, okay?
Okay.
So we're looking to make sure they're even and equal, perfect, and that they're constricting. Good. And no dizziness or pain with that? No light sensitivity going on?
Nope.
Or any light sensitivity? Good. Okay. Next, if I could have you take a look at this pen and follow it with your eyes and notch your head. I'm going to be moving it around. Good. Doing a great job, Janisa. And then one more thing, we're going to move this nice and close to your face and just keep your eyes on it. Good. Eyes are accommodating. Perfect. All right, Janisa, your eyes seem to be doing good. I can see that you've been following me around the room and you're responding as well. So that's all good. Next, we'll be testing your vestibulocochlear nerve, your hearing. So I'm going to go ahead and have you close your eyes. I'll make a little sound on both sides of your, or on one side of the ear, one side of your head. Just let me know where you hear it, okay?
Okay. Left. Right. Both.
Perfect. All right, your vestibulocochlear nerve seems to be doing great. Next, we'll test your facial nerves, which are 5 and 7, your trigeminal and your facial nerve, respectively. So, could I have you smile for me? Oh, beautiful. Could I have you frown? Could I have you puff out your cheeks and furrow your eyebrows? Good. Alrighty, and then could I have you close your eyes? And I'm going to be tapping you gently with a cotton ball, and I'd just like for you to let me know where you're feeling that sensation.
Okay. Left forehead.
Good.
Temple. Left cheek.
Good.
Right cheek. Right chin jaw.
Your right chin jaw works. Good. Nice job. All right, so those seem to be intact. We'll next check your oral nerves, which are 7 your facial, 9 glossopharyngeal, 10 vagus, and 12 hypoglossal. So could I have you open your mouth and go and stick out your tongue? Just taking a look in there. Everything looks good. Nice mucosa. Everything looks nice. Do you feel dehydrated or lightheaded? Good. All right. Could I have you repeat after me and say light, tight, dynamite?
Light, tight, dynamite.
Good. And then could I have you stick out your tongue one more time and go left to right? Very good. Everything looks right there. And lastly, we're going to check your accessory nerve, number 11. So I'm going to put some pressure on your shoulders, and I'd like for you to try to lift your shoulders up, please.
Okay.
All right. Very good. And while we're doing that, we're just going to go ahead and do a little strength test.
Okay.
All right. Could I have you bring out your arms like you're protecting yourself, and then I'm going to go ahead and push on you, and I'd like for you to resist me, okay? Good. Nice and firm. Perfect. And go and pull. Great. All right. Could I have you try to touch your thumbs to each one of your fingers, please? All right. Everything looks good there. Next, we're going to go ahead and assess your lower body strength. So could I have you try to pull your leg up? Good. And then the other one, nice and strong. Very nice. All right. We're going to go ahead and check your feet. And while we're down here, we'll do a little cap refill test. Good. Everything looks good there. Could I have you try to pull your feet up and go ahead and push the gas pedal? Very nice. All right. And could I have you just wiggle your toes really quick? Good. Your feet feel nice and warm enough. They feel good. I'm going to go ahead and place some hand sanitizer on because we just touched your feet. All right. And then I'm going to be assessing your neck and your face a tiny bit more here. Got to dry to die. All right. So your face feels nice and warm, good color and all that. Could I have you turn your head to the side, please? Good. No JVD. And then the other side as well. Very nice. Okay, any pain with that motion? All right. I'm going to go ahead and palpate your carotid artery really quickly. Nice pulse there. Good. All right. Very nice. All right. And then next up, we're going to assess your. What do we do next? We'll check your chest. So I'm looking at your chest. It's breathing nice and evenly. Everything looks good. I'm going to go ahead and put my hands here. Awesome, everything feels great there. All right, I'm also going to check your pulses in your upper extremities. So we'll go ahead and come here. Radial pulse feels good. And brachial pulse also feels good. Wonderful. Alrighty then. Do you ever feel as though your heart is beating very hard at all? Or do you ever feel any swelling going on in your or see any swelling going on in your body?
No.
Awesome. Alrighty. Next up, I'm going to go ahead and take a listen to your heart. So I'll grab my alcohol sweat, and I'm going to go ahead and clean my stethoscope. And the patient would be in a gown, so we'd expose that chest, but not exposing too much or more than we need to. We're going to start with the diaphragm, and we'll start right of the sternal border, second intercostal space. Lub dub. Left of the sternal border, second intercostal space. Here was the aortic. Here we're listening to the pulmonic. We'll go to the left of the sternal border, third intercostal space. We're listening to Erb's point. Fourth intercostal space, we're listening to the tricuspid valve. And if I could have you just lift your breast tissue up really quickly, perfect. We're going fifth intercostal space, mid-clavicular line for the bicuspid valve. So then I'll flip around to the bell, listen for S3 and S4 sounds and just make my way back up. And here, and we don't hear anything there, so that's really good. So like I asked you before, no family history of heart issues. No one died from, or did anyone die from a heart attack or any other complications there? Good, I'm glad to hear those things. So while I have you seated up, I'm also going to take a listen to your lung sound, all right? So using the diaphragm, we're going to take a listen to your lungs on both sides, and every time I place the diaphragm, if you could take a nice deep breath in and then out. If that's hurting at all, or if that's making you lightheaded, let me know, and we'll just take a break and we'll resume when you're ready. Okay?
Okay.
So for the purposes of this video, we won't be taking our breaths in, but we're going to start superior to the clavicle for the upper lobe of the right side. Breath in, breath out. We'll do the other side. Breath in, breath out. Make our way down to the second intercostal space. Breath in, breath out. Across to the right side. Breath in, breath out. Breath out. Fourth intercostal space. Breath in, breath out. Breath in, breath out. If I could have you lift your breast tissue up, please. Down to the sixth intercostal space. Breathe in, breathe out. Breathe in, breathe out. And then we go to the mid-axillary line intercostal space. And same thing on the other side. Good. Are you feeling lightheaded at all? All right, everything's feeling good there? Awesome, wonderful. So we're going to go ahead and continue on to your abdomen.
Okay.
So I'm going to go ahead and bring the bed down a bit.
Okay.
And we'll go ahead and take a look and a listen. All right, doing okay there?
Yeah.
Perfect. All right, so we're going to go ahead and expose your abdomen. And I'm just going to go ahead and take a look. We don't see any lesions. Everything looks pretty normal. I'm also noticing that her chest is rising and falling evenly. So everything looks good there, and like no pain or constipation at all, no diarrhea, nothing like that. Good, glad to hear those things. All right, so we're gonna go ahead and take a listen after we've taken our look, and we'll start in the lower right quadrant. And we'll go here, and we can hear gurgling within the first 3 to 5 seconds. Everything sounds good. Upper right quadrant, everything sounds good because we're hearing noises. And here as well. Perfect. All right. So sounds like your GI tract is moving and grooving. So next up, we're going to go ahead and just do a couple palpations, which means I'm going to be touching around there just to feel for any firmness or something weird going on there. Okay. If it hurts, let me know. I'm going to be starting off softly, and then we'll go ahead and do a bit more pressure. Okay.
Okay.
Everything's feeling okay?
Mm-hmm.
Hula hands across.
Hula hands.
Good.
Yeah.
All right, so now we're going to be checking for rebound tenderness. I'm going to press firmly, and then I'm going to retract quickly, and then let me know if you feel any pain, okay?
Okay. Nope.
All good?
Yep.
Good, I don't feel any firmness or anything like that. Good. Perfect. Alrighty. So we're going to go ahead and take a look at your pericardium now, which for this purposes, we won't do that, but I'll look for bladder distension. I'll also ask you if you're having any burning peeing. Any sensations while peeing? Do you have UTI right now or anything like that? Good. All right. Glad to hear these things. So that is addressed. So we're going to go ahead and now take a listen to the back of your lungs. So your gown is on. It's probably tied up in the back. And I'm going to go ahead and lower the bed down. Do you need any assistance getting up?
No.
All right. So I'm going to have, once the bed's nice and low, I'm going to have you swing your legs off to the side. And I'm going to go behind you and take a listen to your lungs from the back.
Okay.
Alrighty. Alright, so same thing here. Every time you feel the stethoscope, let me know if you are. Please take a nice deep breath in and out. I'm looking at her back. Everything looks nice and symmetrical. I'll take a look at the front line. The trachea looks nice and centered as well. And if I could have you, and I'm also looking for any abscesses on any bony protrusions. The sacral area looks nice. No broken skin there. If I could have you give yourself a hug really quickly. Perfect. I'm going to go ahead and find C5, go a couple inches down to C7. We're on the diaphragm, yep. And then we're going to take a nice deep breath in and out, going across, in and out. The chest or the back would be exposed, in and out. And we're going to go ahead and J down all the way, in and out, starting to flare out. Good, nice deep breath in and out, making our way around to the mid-axillary line. Perfect. And then same thing on the other side. Deep breath in and out, in and out. Mid-axillary, right over here. And then we're gonna go to the mid-axillary nipple line to make sure we're here that right middle lobe. Perfect. All right, you can go ahead and relax those arms. Just 2 more tests to be doing. We're gonna go ahead and do your balance. So if I could have you stand up as we ensure that you have non-slip socks on. Place your feet together and go ahead and just try to close your eyes and hold that steady. Perfect. So we do this for 30 seconds. For the purposes of the video, we will go ahead and skip. Awesome. So great balance there. The last thing we're gonna do is we're gonna go ahead and do a heel-toe walk all the way down to the end of the bed. As she's doing this, I'm checking her heels and sacral area again to make sure there's no openings. Perfect. And go ahead and turn around, and you can walk back to the bed normally and get yourself comfortable. All right, Janisa, so that concludes our assessment. Did any pain occur while we were doing any of that?
No.
Good, I'm glad to hear those things. Here's your call light. Would you like me to adjust the bed at all?
No, it's
Awesome.
perfect.
Is there anything I can get for you? Do you need to go to the bathroom before I leave?
No.
All right, glad to hear that. If you do, please hit your call light and let us know if there's anything we can do for you. I will perform hand hygiene. I will, I should have made sure that there's no catheter attached and no tubes attached to her that need to be reattached at all. And then I will make my way out and document my findings.